thank you. It's so nice to see all of you guys here to support and learn about this wonderful talk. I will be talking a little bit about more of the basic foundation, posture, anatomy stuff, a little bit of the boring stuff before Miriam and Tara kind of get into the more of the juicy stuff.
Reshma, can you speak closer to the microphone?
Can you hear me now?
Yeah.
All right. So this is just a slide just that we have no disclosures, and our goal is of our presentation is to feel empowered and learn new perspective regarding posture, movement, and intimacy. So essentially, posture is a dynamic event. It can be learned, it can be taught, it can be practiced. And so what happens is experimentation becomes gesture, gesture becomes habit, habit becomes posture, and posture becomes structure. And structure really addresses our physical body, our musculoskeletal system, our fascial system, our nervous system, and that posture is the foundation of that structural integrity. Mind and emotion is the foundation of our posture. So kind of going back to just the basics, okay? So we have three main curves in the spine: your cervical spine, your thoracic spine, and your lumbar spine. The cervical spine has 7 vertebrae, thoracic 12, and the lumbar has 5. Within the function of the cervical vertebrae is essentially to hold your head up. And the function of the lumbar spine is essentially to hold your body up. So we need to make sure that these curves are in balance with one another. And when these curves are not in balance with one another, that's how you have pain and dysfunction. How you can tell if it's in balance with one another, a good posture essentially is you just want to have a straight line from your ear, your shoulder, and your hips. Okay? If you have a straight line from your ear, a straight line from your ear, shoulder, and hips, you technically have good posture. But if you look at poor posture where you have a sway back, you know, that line isn't there. You know, a part of my hip line is forward to my ear line. And then if you have a flat back, again, with the flat back, you, the line of your hips is far posterior than the line of your ear. So, or even a forward head position, right? But that's what brings on some of the issues with pain and dysfunction. So with posture can convey some of your mental well-being, okay? And so what happens is that even emotions within the body are conveyed with posture. So you can tell, like, when someone's feeling really good about themselves, they have a really good sternal lift, okay? When someone is really depressed, anxious, sad, they tend to be in this rounded, flexed posture. So sometimes I can walk around and you can tell if someone's having a good day or a bad day, sometimes by how they carry themselves. So, and a lot of times when they're in this chronic poor posture situation, that can also lead to dysfunction. That can affect breathing capacity. If you're always kind of in this slouched, depressed position, you may not be able to really breathe fully, and that can affect your cardiovascular system. So again, posture is not just about looking good and holding your head up high, but it also knowing that posture can influence your whole body systemic system. So what is the core? We hear about the core. What is the core of your body? Okay, it's really only 4 muscles. The 4 muscles are your diaphragm up top, your pelvic floor on the bottom, your transverse abdominis, and then your multifidi muscles. Okay, and so those are the 4 muscles that influence your core. So I wanted to kind of talk to you about our canister approach. A lot of times there's been the fad of, what do you do? How do you strengthen your core? What do you guys do to strengthen your core? Pilates, sit-ups, Pilates, crunches maybe, planks. Some people do back extension exercises, right? The big thing is, when you're doing sit-ups, for example, Pilates is different. Pilates is much more holistic, which is great. But when you're doing sit-ups, you're only addressing one part of that core, okay? We need to understand that this is a canister approach, okay? So really looking at the integration of the multifidi muscles in the back, the diaphragm up top, the transverse abdominis in the front, okay, so this is your transverse abdominis down here, and your pelvic floor. So the integration of all four muscles working together in a coordinated way gives you the stability, gives you good posture, gives you the ability to actually move better. So when you have good trunk stability, your legs and your arms can work much better. So if you kind of think of it, when I talk to patients, I think about your core being the foundation of your house. So if you have a weak foundation, it'll be harder for you to move your legs and your arms off of that strong foundation. So if you kind of think of your arms as the walls of your house, if you don't have a strong foundation, your walls will crumble, right? But if you have a good strong foundation, your shoulders will be able to function better, so then maybe less of a shoulder issue, or maybe less of a hip or a knee issue with your legs. So making sure that in addition to just doing your leg exercises, working on the stability of your core and addressing all four muscles at the same time. We're going to show you how to address some of these muscles.
When we think of our core muscles, we can think of them at the center of our body or trunk. And surprisingly, there are only 4 of them. These muscles don't move any bones or joints. They engage to support the trunk for other movements. Set into the lower trunk, we can think of them as shaped like a can of soda. First, the transverse abdominal muscles wrap around the sides of the trunk, meeting at the center line on the front. These would be the sides of the soda can. The diaphragm caps off the top of the can. It is located on the lower edges of the rib cage. It is a thin dome-shaped muscle that separates the chest cavity from the abdominal cavity. The pelvic floor is actually a group of muscles that work as a unit. They are located at the base of the pelvis, between the 2 sit bones, and slinging from the coccyx to the pubic arch like a hammock. They are the bottom of the soda can. The 4th are another group of muscles called the multifidi. They are small muscles that only span between 2 or 3 vertebrae, but are grouped all the way through the spine. These would be the back of the soda can. Together, these muscles stabilize the body and control the pressure inside the lower trunk, much like the pressure in that soda can. These muscles don't do the heavy lifting, but without them, the other muscles would not be able to function because they would have no stable base to work off of.
So to talk a little bit about the pelvic floor. The pelvic floor has 5 support functions. One is to support. Your pelvic floor kind of hangs like a hammock from front to back and side to side, and it supports your organs. It's there to support your uterus, your bladder, your intestines. It just kind of holds it in place.
Your prostate.
For the guys in here.
Thank you.
The pelvic floor muscles are always on, and they increase in tension when there's increased abdominal pressure. So when you're coughing, sneezing, laughing, that increases abdominal pressure. Now I can hear you. Okay. That increases abdominal pressure, and then and that increases the tension of the pelvic floor. The second function, sphincters. They make sure that you don't leak. Okay, they make sure that we're able to hold our urine and our bowels in when we need to hold them in, and we're able to eliminate when we can eliminate. When these muscles become weak, that's why we have incontinence or leakage issues. Now, I do want to emphasize that when there is weakness, that doesn't necessarily mean that all of us need to go walking around and doing Kegels all the time, okay? A lot of times we get weakness when there's increased tension of that pelvic floor. So when there's increased tension of the pelvic floor, we can't generate enough force to hold that contraction. So often we need to work on relaxation exercises before we can actually engage in stability strengthening exercises. The third one is a sump pump, and it just helps move the lymphatics through the system, through the pelvis, through the trunk, and that's just really important during and after pregnancy. The 4th one's stability. We talked about the importance of stability in that canister approach. And the 5th function is sex. So when you have a good, healthy pelvic floor, you have better arousal, better orgasms. So it's just really important to have a strong, healthy, happy pelvic floor. So the diaphragm. what I wanted to have you guys appreciate is that pelvic diaphragm is continuous with the respiratory diaphragm. Okay, so all these muscles, you have your diaphragm up here, and then you have your hip flexor muscles here, you have your pelvic floor muscle. It's a continuous closed circuit. So one influences the other, okay? And that's why sometimes it's important to breathe during exercises. Often when we're engaging in exercises and you're holding your breath, you're actually creating more of you have an unstable situation versus a situation where you have better control. So kind of talking about the breath stability. When you hold your breath during exercise, that's a sign of weakness. It's an unconscious attempt that you're trying to create the stability. So if you're lifting weights and you hold your breath, you're trying to create an unnatural stability, an inefficient stability to the system, okay? And holding your breath creates stiffness by kind of retaining a column of air in the trunk. So you're just kind of, it's not your muscles doing the activity, okay? When you are using your breath, that's a sign of strength that you're able to breathe through the exercises. It allows for sustainable function. We don't walk around holding our breath. We're always breathing as we're moving. So incorporating breath with activity and being able to coordinate that. So this is just an example. I want all of us, we're going to do a little bit of diaphragmatic breathing. But again, just an appreciation of how the respiratory diaphragm and the pelvic diaphragm, they work in concert with one another. So when you're inhaling, your pelvic floor diaphragm is also moving, and when you're exhaling, it's moving as well in a coordinated fashion. So I want with diaphragmatic breathing, it actually helps improve mood. It relaxes your autonomic system. It decreases any sort of anxiety. Is there anything else? No. So we're going to practice this, right? Okay. So what I want to do, it's just, if you can remember the 6-2-7 breathing, and we're going to use this as part of diaphragmatic breathing. I just want you guys to have both feet on the ground. And I would like you to inhale a count of 6, pause for 2 seconds, and then exhale for a count of 7. So when you inhale, slow breath, inhaling and having your abdomen rise. Okay, for a count of 6. Hold it there for 2 seconds, and then exhale, allowing your abdomen to fall during the exhale for a count of 7. Let's do this 3 more times.
Feet on the ground, and gently inhale for a count of 6. 1, 2, 3, 4, 5, 6. Pause 2, and exhale 2, 3, 4, 5, 6, 7. Inhale 2, 3, 4, 5, 6. Pause 2, and exhale 2, 3, 4, 5, 6, 7.
So some of the exercises for your transverses, what's the easiest way to kick on your transverses or have awareness of the transverses? This is just a little video of Miriam finding what pelvic neutral is. She's doing a cat-cow, finding the pelvic neutral. If you see her lower abdomen kind of pooch out a little bit, now she's sucking in her lower abdomen. We can actually work on this. We can all do this. If we stand and maybe hold on to the back of your chair. So if you're holding on to the back of your chair, just like this, okay? And then she's just gonna let her belly hang. Let your belly hang. And then go ahead and engage your lower abdominal, suck in that belly so it goes towards the spine. And that you're engaging your transverses. Okay? You will feel your transverses engaged, not your rectus abdominis, not your obliques so much. But what you could do is go ahead and allow it to relax, and then go ahead and lift your transverses.
And the important thing here is to not move your spine. A lot of times people will start to do a little bit of cat-cow in there. Cat-cow is great. This is the same thing. Just allow the belly to move away from the spine, and then just draw it in to hold the spine like you're giving it a hug. It gives it a little bit of stability.
The big thing with these contractions, these are not maximum contractions. These are just submax. They're very slow, like subtle contractions. So it's not where you're actually creating this maximal load to your system. This is another exercise suggestion that we could do. We could also do this standing up with the chair as well. But this helps activate your multifidi muscles. So when you actually have your transverses contracted, you can actually activate those little tiny muscles of your back. Remember that diagram that we had? And that's really working out your back muscles. For those that can't really support their hands, this is just another variation of doing it on your elbow.
You
Okay.
gotta protect your wrists and your thumbs.
And then you can also do it in the plank position. Very strong. She has good stability. That's why she's in the videos and not me.
Reshma's the one that makes me strong, though.
So how we move is an expression of ourselves. Sometimes when you're, I'm guilty, so I like to people watch. And sometimes I'll just sit and watch people, right? And you can see, I can tell the soccer players from the tennis players from the swimmers just by how they walk and how they hold themselves. And I've been pretty accurate on a lot of occasions. But how you carry yourself is who you are. How you carry yourself kind of projects what you do sometimes. So that's just so just understand that posture and movement are interrelated with one another.
Wait, oh, when you guys, can you explain to them about the picture?
Yes, I will.
Everybody in this picture is in this room.
So pain can inhibit mobility and habit can affect posture. For good habit and bad habit, okay? We talked about that. And so what you practice is what you become. So this picture was taken during a layover in Doha. And we were on the sand dunes. This is Urpana. This is me. This is Bhavna, and that's Miriam.
How's Miriam?
Look at Bob. Yeah, some good air there.
How to contract the pelvic floor. There's lots of physicians in this room, but I can tell you right now that not every single physician understands and how to instruct on how to contract the pelvic floor. Often we get patients in our clinic and they have not been instructed on how to do this properly. So many people assume that they're doing it, but they're not doing it the right way. And they often become butt clenchers. They often, butt clenchers is the technical term, where they hold their breath or they activate their adductors instead. They have very, very little awareness. And especially those women, especially that have been raised in a very conservative, strict household, whether it's a religious upbringing, they tend to have they don't have that mind-body connection. So it's really important to understand that, but then also being able to guide folks on how to contract the pelvic floor the right way.
Dr. Miriam Graham talking about Kegels or pelvic floor contractions. A lot of times people think that a Kegel is an exercise you do while you're trying to pee, that you should stop that flow of urine multiple times while you're trying to pee. That's not an exercise. Stop doing that. It can mess with how you're able to fully empty your bladder. So don't do that anymore. It is an activity that can be done to identify the correct area you want to contract. A lot of times people get confused between, is it my glute that I want to contract? Is it my inner thigh area? Is it just everything down there? It's not. We're going to be very specific about the levator ani or the pubococcygeus. Once that muscle's been identified, you can learn to do different types of contractions with it for strength, for endurance, for coordination, for power, just like any other muscle. So let's talk about that. The first exercise, you're going to think of contracting around the anus and the vagina, if you've got one, and lifting up towards the crown of your head. When you do that, you're not supposed to contract your glutes or your butt or your inner thigh muscles or tip your pelvis or contract your abdominal muscles. It's just that central area. So you can think of doing an agility exercise. An agility exercise is going to be when you contract the muscle and hold and let go. And you're going to do that 10 times quickly, okay? So those are called quick flicks. It's a little bit like the football players running through the tires. It's agility. You want to contract and then let go fully. And frequently what happens is people stay contracted a little bit, so then the subsequent attempts are less powerful because they didn't let go all the way. Remember, a weak muscle is a tight muscle, and it's very important to let go all the way before trying another contraction. A graded pelvic floor contraction is when you choose the intensity of muscular activity you're going to produce during the contraction. So it's analogous to being in an elevator. You can go up to the 5th floor, or you can go all the way down to the 3rd parking level, let's say. At rest, your body is at the lobby level. You can get into the elevator, contract that pelvic floor, maybe up to the 3rd level, maybe even up to the 5th level, and then come back down to that lobby level. Analogous to having a dimmer switch on a light. You can have the lights all the way up or a little bit dim. It is the ability to grade the contraction that is part of the coordination that helps with endurance, power, and function of your pelvic floor. An endurance or power contraction requires you use the same intensity of muscle force that you started with throughout the entire contraction time. Power is work produced over unit time, so it's important to maintain that same intensity throughout the duration you've chosen. Initially, that might be a 3-second hold, a 5-second hold. Frequently, a long-term goal is to have a 10-second hold. Remember all of the components of the pelvic floor contraction. You want to be able to close down like the iris of a camera around the sphincter area. Additionally, you want to be able to close down and lift towards the crown of the head. So there's a lifting up of the pelvic floor contraction, and that's maintained the whole time. Frequently what happens is people will do a contraction that starts out pretty reasonable, but then it starts to fizzle and they lose power. It's like they don't even know where the muscle is anymore. So it's much better to go with a shorter duration and maintain the force throughout the entire time versus start out really strong and fizzle. So that's a power contraction or an endurance contraction. Again, the goal would be about 10 seconds.
So with the pelvic floor, we want to make sure we do functional movement patterns like squat or coordinating the pelvic floor with breath and incorporate the deep core. So if you really think about it, women in developing countries do not have a high incidence of pelvic floor issues, okay? Because they have to squat down to void. And so we see very little knee issues, very little hip issues, very little pelvic floor issues in those countries. In developing countries where we've been trained to use the toilet, very few folks can really get down to a full squat. So often that's the normal posture in our patient population. They don't have ankle range of motion. They're not able to fully squat. They're having some back issues. So just to understand that how your core influences your pelvic floor function. Okay.
This is really functional because you need to be able to do it when you're lifting. If you're lifting a weight, you need to be able to get down there. You're going to go up to get the pelvic floor to automatically contract. With a exhalation, the pelvic floor is going to contract. And then you want to think, closing down around that iris of a camera to Kegel. So, that's what you do with all of your, that's what you do with
the heels, right?
Thank you. Show off. I just got some more quad exercise there. No, but you want to do that with all of your lifting. So then you have the automatic connection between the breath and the strong core that Reshma was talking about. So I like that slide because a lot of times people get down the bottom of their squat and they let their butt come under. That's called winging. Don't do that. You need to keep your tailbone out and your abdominals engaged and then come up to a stance. She emphasized posture and stability and I emphasized mobility. And I think it is illustrative of who we are. Our name is Restore Motion. It's our initials, Reshma and Miriam. I'm definitely the movement one. And we need both. So I want to show you what you're made of in the next few slides. The answer to a question that people have, I will be able to provide. Yes, men do have a pelvic floor. Many times people say that they don't know that men have one. I'm like, come on. All right, so we're going to get into some operation instructions here. I love this slide because I think it's pretty straightforward. We have the male on the left, a joystick with a couple of buttons, maybe. On the right, we have the female. You need operation instructions. You can't mess this one up. You can't get very far not paying attention to the details. Women need to have more aspects integrated for spontaneous sexual drive. It's dependent on many things that both I will talk about and Tara will talk about as we move forward. It's interconnected aspects and events. So let's look at some of the similarities between male and female function. The top of this slide illustrates what's going on basically in utero, where you have very similar genitalia when the baby is developing, and then as they are born, it differentiates into female up here and male there. I know it's confusing because now this is female down here and this is male over here. But what's really cool about this slide is that they're the same muscles, exactly the same muscles. So I know that women think like pelvic floor issues, it's a woman's thing, but oh my gosh, these poor men, they have nobody to go to because they don't know that pelvic floor is a real thing or that pelvic floor pain is. A lot of times they would see someone and then it's assumed that they have an infection and they'll take antibiotics and sometimes they feel better for a while and then there's an issue. So when Reshma and I started, we were very advocate of women's health, and then men started to come to see us and we're like, well, you know we're a women's health practice, right? But we started working with the men, and I'm so glad that we did because I think we've changed a lot of lives. I know both with male and female, we've been the cause of babies, bringing life into the world. So not the way that you all do, but definitely had something to do with it. Yeah. All right, so just know that male and female, they have the same equipment, just different plumbing. This is another really great slide. I love this idea that women and men have the exact same amount of erectile tissue. The exact same amount. The issue is that women's erectile tissue is more internal, it's not seen. And men's erectile tissue is a little bit out there. Now, there are more women in the room than men, and I'm just going to have you take a moment and think. What would it be like if you had a penis? I mean, they get in the way. They do things when you don't even think about it. It's like all of a sudden, what? I mean, that's really hard to grow up with, you know? So
I think I've learned to appreciate my male folks because they're always aware that they have something there. And I just want the women in the group to be able to appreciate how and where you have your erectile tissue. So the clitoris has one function, pleasure. The glans penis has double duty. It's the urethral outlet, and it's very sensitive. The head of the penis is sensitive, just as the head of the clitoris is sensitive. But just because you can only see the head of the clitoris doesn't mean that you only pay attention to it. There's other erectile tissue to work with. All right, so when I was putting this slide together, you know how it says alternate text? It came up with cartoon of a banana body. So this is an illustration of the female erectile network going from not being aroused to partially aroused to full arousal. And not only is the tissue enlarging, when the tissue is becoming more engorged, it closes down around the opening of the vagina, and that can improve sensation for someone who's penetrating that. And I say that because I want to be mindful that there are many ways to get things done in the world here. So no changes in the urethral and perineal sponge with this, and that it closes down around the introitus. So types of intimacy. We just talked earlier, I showed you the picture of the cockpit and the joystick, that the way to get that airplane flying is to be aware of different aspects of intimacy. And there's the emotional intimacy of being together. There's the experiential intimacy. I feel like we all came back from Bhutan with a very renewed sense of community. And then there is obviously the physical intimacy as well. But as we go through life, through different health challenges, through different aspects of our life, it isn't necessarily that we're always able to have physical, sexual intimacy, but we can still have intimacy. So be mindful of that, and Tara will elaborate on that a little bit more. I also just want to have one more quote that I want to say here, that this was from an article. Again, I have a reference slide, and so all of the references are in the back of the PDF, so you don't have to look anything up. Disruption of the endocrine, neural, or vascular response caused by aging, disease, surgery, or medication has the potential to lead to sexual inadequacy. At the same time, physiological and relationship factors play an important role in healthy sexual response and may enhance or impair sexual function. The brain is really our largest sexual organ, but I want to get into the body just a little bit because I can't help it, I'm a physical therapist. How many have heard of referred pain? Have you all heard of referred pain? And so one of the ways that we hear it is like a heart attack going down the left side of the jaw. How many have been dry needled in here? Okay, so you know referral in a different way because the muscles have a relationship where they will refer pain distal to where that trigger point is. So what we're looking at is trying to flip that for referred pleasure. Let's look at the adductors for one moment. The adductors are very important muscles in the gait cycle. They never turn off. When we're walking, our hamstrings and our quads cycle on and off about 60-40. Isn't that right, Rishma? About 60-40? The adductors are always working. Your adductors are working right now as you're sitting. Whether your legs are crossed, whether your legs are on the floor, no problem. You're using your adductors. So it's very common for adductor area to have increased tension. And that can lead to muscular trigger points. So what I am proposing is that you flip that idea and say you are trying to have an intimate sexual relationship, or maybe you're not having a sexual relationship,
maybe you're just trying to get something kind of started a little bit, stimulating the adductors in a pleasurable way increases awareness of the pelvic floor. It increases the blood flow to the area and can help with mobility. So this is a very important area. And I don't know if, for those who are not familiar, this is just the picture of the adductor muscle group, how they look, and they attach primarily to the pubic area, but there's also a little bit around the sit bone area, the ischial tuberosity, so you can feel that for the adductor. And then this diagram is representative of the muscular trigger point idea of Travell and Simmons, where you could have muscle tension like a cramp or a knot in some of these areas, and if you release these areas, they would decrease, you would extinguish the trigger point, but if you don't address them, it can refer to the prostate, bladder, uterus, rectum. So having a trigger point here can refer the whole way. So that's what that is illustrating. I'd also like to say is that tight adductors affect and influence the pubic symphysis, which is actually necessary. The pubic symphysis is a joint. You need to be able to have that move a little bit during the gait cycle. And just behind the pubis is the bladder. And there are ligaments that go from the bladder to the bone of the pubis. So if your pubic area is not functioning well, it can affect your bladder. So just word for the wise, you want to make sure your pubes are in the right place. Referral for pleasure as opposed to referral pain. Skin is our largest organ. Afferent feedback from the periphery connects the brain and body, and pleasant stimulation of this area can improve blood flow and mobility. Other significant referral patterns are the abdominal area will refer to the back and vice versa. And the pelvic floor can refer to and from the feet through the sacral nerves, S2, 3, and 4. So there's a neurotransmitter cascade with arousal and climax. Again, the brain is your largest sex organ. Nearly every area of the brain is involved with arousal and climax. There's significant crosstalk or overlay between the higher cognitive centers and the metabolic centers. Note that there's potential interference or impact with certain medications, particularly the SSRIs or the SNRIs, etc. I'm going to give you 3 slides here that I'm not going to talk about, but they're in the PowerPoint PDF if you need them. These are all of the neurotransmitters and neuromodulators that are active in human arousal and sexual function, and how they regulate sexual behavior. So there's 3 slides here: serotonin, dopamine, norepinephrine, acetylcholine, histamine, opioids, and of course the sex hormones. So many people don't realize that there's a musculoskeletal aspect to pelvic floor. So you all are in the know because you saw the pelvic floor muscles. You now know how to contract your pelvic floor. I also want to have you understand that, I don't know if you all got to see the wonderful day when Kara Simmons and Rachel Rubin got to speak about menopause and hormone issues. That goes without saying. You need to make sure your hormones are in the right place, both men and women. So you want to address that if it's an issue. Incontinence can be an issue, and incontinence can be an issue because you might be weak or you don't know how to coordinate the pelvic floor with functional movement. Chronic constipation, that can also affect pelvic floor function and sexual function. Obviously, low back pain, knee pain, pelvic girdle pain, all those things, that's right in the physical therapy wheelhouse. There's also sometimes the clitoris can become adhesed under the hood of the clitoris. So you need to have good mobility of that tissue in order for the clitoral head to come out from under the hood, have a good time, and then come back in if it's too sensitive. Sometimes men will have issue with erectile function because of a vascular issue or maybe post-prostate surgery. So there's penis rehab. Did you know that? There's penis rehab. You can use a vacuum pump to help with that. There's a really great little protocol you can follow along. It's recommended that you use a vacuum limiter when you're using the penis pump, just to make sure that you don't get too excited about that, too much pressure. And then again, I have this link to a product if you were interested in that. I think this is my first, or one of my first pictures in Kathmandu. Do you see the lock here? Okay, do you see where the hole for the lock is? It's down here. And you see the key? So that's why I have it for my lubricant slide. Now, all of you at the table, you have a goodie bag with a card for Reshma and Miriam. And then you have two different types of lubes. We have water-based lube, which is the slippery stuff. We use that in the clinic when we're doing pelvic floor evaluation. It's really nice, doesn't have a lot of additives, and it is, again, water-based, because depending on your body sensitivity, or if you're using different kinds of toys, you need to use a water-based lubricant. Other ones that you can get are Femglide and Astroglide. KY is awful. Who invented that? It dries up, it's gooey, it's sticky. Don't use KY. Gels that add heat and cooling sound maybe interesting, but they can be irritating to certain tissues. There's another type of lubricant in your packet, the Uber Lube, and that is silicone based. And again, it provides a different type of friction reduction. It's going to be less gooey. The slippery stuff is going to be kind of gooey and more puffy. I don't know how to describe it. The Uber Lube is going to be more smooth, very slippery. You'll have feeling, you'll have sensation, but you don't have the extra goo. So what I think is really good is go ahead and mix them. So that's why you have both of those. So they're there. But you can't use the silicone-based lube with some of the toys. And this website right here, there's a place in Wisconsin called A Woman's Touch. It's a shop. And they're a wonderful resource for sex education. They also have samplers. So you could buy a sampler of maybe like 3 or 4 different types of lubes so that you can figure out what works for you. So it's a good resource for you and your patients. So it's called A Woman's Touch, and that's the link. And no, more resources. Another issue, I was shocked. I was reading a piece that I wrote to my daughter and some of her friends, and we talked about that. And they had said that they learned about sex from porn. And I'm like, you learned about sex from porn? That's awful. So that's one of the things that I want to write about, to make sure that people don't have to learn sex from porn. But Oh My God Yes is a website. Has anybody seen that? Oh My God Yes? Good, thank you. It is a website that is devoted to learning about sexual function, primarily for women or female partners. But if you're going to be working with a female partner, maybe you want to learn about Oh My God Yes too. But it's done very well. And I would highly recommend you look at Oh My God Yes. And if you have a daughter, I would highly recommend you look at Oh My God Yes. Another website, and Rachel Rubin had recommended this as well. Mystery Vibe is a company that makes toys for both men and women. And they have high quality toys you can look at, so that's there. Another information book is called Women's Anatomy of Arousal by Sherry Winston. I actually met her when Reshma and I presented at the ASAC conference. What was that, 2014, I think we thought? It was a while ago. Anyway, lovely book. I think it was 2014. Anyway. And then Restore Motion, we have a YouTube channel, and we have all kinds of things on there. It's not just sex, I promise. And subscribe, please. But I have here, what you didn't get to see is me explaining the different concepts of how to do a Kegel. So know that you have resources on your docket there. And then lastly, I want to just share a quote that a good friend of mine said about being in a long-term relationship. And long-term can be 3 months, depending on who you are. Long-term might be 30 years, I don't know. But here's the quote. Even though you could finish my sentence for me, because we know each other so well, please don't. I'm changing, and I may no longer say what you think. So with intimacy, with sexual function, the intention to be present, to be really present, to not just think, oh yeah, this is what we do. The intention to receive, it's important to receive as it is important to give. The intention to give. The intention to release assumptions and expectations, and exploration with permission. It's not a race to the end. What a wonderful homework assignment. I'm going to now introduce my colleague Tara. She is a master's MSW from George Mason University, excuse me.
Say George Washington.
No, George Mason. She's from Sunstone Counseling, and she loves working with couples and individuals experiencing conflict within their personal and professional relationships. She has interest in childhood adversity, trauma, cultural conflict, ADHD, diversity, sexual and gender identity. What don't you do, Tara? That's amazing. She enjoys hiking in the great outdoors and ping pong and belly dancing. Nice combination, I like that. Ping pong, belly dancing, outdoors. And previously she was a personal chef. So come on up and take it away.
Right. This feels like an exposure therapy since it's my first time speaking ever, and I have public speaking anxiety. So bear with me. I think it's a prank. Amy probably behind it, my co-owner. But whew, all right. To start, I'm going to do a mindfulness exercise for my own sake and yours as well. You all have one of those bags. Please take your bag. And I might put the microphone aside. I could be loud enough. That's what my husband says. All right. We're going to pick up the bag. Look at the color of this bag. As if we've never seen a bag before in our lives. We're going to open it and feel the texture. Close your eyes if you could as you feel the texture. And touch it. Implement all your sensation into this touch. Go up and down. Pretend you were just born touching something. When you're first born, the first thing that happens to you is being touched. Touch is such an essential part of our life, especially when it comes to intimacy. Next thing is open your eyes. Sight. Pick up the candle that I provided for you. The next thing is the match. And maybe another match. All right, close your eyes, bring it up to your ear, and I want you to shake it. Again, use your senses. Hear it. Again, you're a born baby. You touch, you see, now you're here. Bring it back to your sight. You're gonna open it. Focus. Light. Do it again. You never give up in life. Just don't. All right. Here we go. You're the best. All right. You all have your candles. Take your time. It's okay. We're not in a hurry. The whole point of my talk today is about slowing down. Slow down. Get to experience life. Don't let life go by. All right. Put your candle in the palm of your hands and feel the weight. Close your eyes. Feel the weight. Trust your body. Just trust. Now open your eyes, look at the candle, and I'm going to ask you to focus on the flame for about 30 seconds without blinking. I'm shaking. I hope you're not. Look at the movement of the candle. Look how slow. To build a fire fast, it's not fun. It will die really quickly. But to build a fire slowly, it's intimate. It's fulfilling. It's building a connection with you and the candle. Bring it back to your nose. Smell it. Now we're using your senses of smell. Inhale, exhale, and with a big breath, make an intention for this. Have an intention for today, for the rest of your day. Think of what you want to have your day to look like today. And then blow it. Smell the fire. And that's my ladies and gentlemen, 1, 2, 3 gentlemen, mindful exercise. And this is what we are talking about today. Mindful sex. We often think of sex as a goal-oriented activity, with the end goal of being the primary focus. What if I tell you, what if I told you, because English is not my first language, I said tell you. What if I told you that the journey toward intimacy is, I'm so sorry. The journey toward intimacy, it's as fulfilling as the destination, which is sex. Most people think about sex as a doing, as a performance, instead of as an experience. Sex is an experience. Mindful sex and intimacy, I can see better here. It's about awareness. I'm sure you've all heard of mindfulness. Mindfulness is Eastern practice that it was popular in the 60s, 70s, died, came back, and it's a buzzword right now. And what it means really, mindfulness and meditation really, they're cousins. It's being aware of the moment without judgment, period. That's it, really. What we did right now, that wasn't mindfulness. That was mindfulness in action. To improve your sexual health. So in my practice, I see a lot of couples. When they come to me, they come with an intake forms. I ask them to fill it out, and it says communication. It's always communication. And then after a few sessions, I find out that they're not having sex. Guess why? Because the highest form of communication is sex. It's bodily fluid communication. And the way you arrive at is through awareness and through intimacy. Intellectual intimacy, this is intimate. I'm sharing with you something I'm very intimate about, which is passionate about, sex. But sex is not the goal. It's the experience, it's the anticipation to get there. One of my favorite neurologist / biologist, Robert Spolsky, said once, happiness is what's happening to you. So I took that and I was like, I can apply to sex, because the participation, the anticipation, the intimacy, the journey to get to the orgasm, which is easy to do, is happiness. But the process is what gets you there. So if you fast forward, like the movies, you're not going to have an amazing experience. But if you slow down and you get to experience the sensation, be aware of your own body and sensation doing sex. Ask yourself, as I'm having sex with you, not literally, but we could. I'm just kidding. I'm not like that, but anyways. But as you're going through the process, if you focus your sensation like we just did, your hands has so much nerve endings. Feeling the touch of your partner, smelling his breath, watching him move, or her partner, let's just put partner. It in itself is fulfilling. In itself is connecting. In itself, it's pleasure, you know? So when we're in the middle of having a sensation experience, we want to be aware of it with zero judgment. So we always, as we're having sex, we're like, how do I look? I wonder if my boobs are sagging. Or I wonder if, you know, like I look good as, you know, I'm awake or whatever. Don't do that. My advice, which I gave to somebody here in the room, and called me and said, hey, I listened to you, and I went inside my body. I went internally into every cell of my body as I'm experiencing my sexual experience. And I was like, wow, that's amazing. Because I want you to be sex and not do sex. We're not Hollywood. As she was saying, pornography is not what you learn about sex. Pornography is entertainment. Pornography can I choke you and come in your face. That's not sex. That's entertainment. Sex is an experience. Practice of mind and body connection, I think we just did it. The reason I said slowing down in the movies, because we grew up in a culture, I've been here for 38 years, and I used to think, America, wow. Sex, yes. I come to America and it's fucking conservative. I'm sorry. There's such a strong belief system here about sexuality, but outside of America, we think America is about sex. Everything is about sex. But no one talks about sex. It's a taboo. The only place I've been to where people talk about sex like food is Greece. They're amazing. We talk about sex in the subway, you know. They talk about sex anywhere. It's like insane. I was like, oh, I should be Greek. And so, yeah, so we want to normalize it. Talk to our partner. You know, my couples, I give them homework. I call it sex happy hours. I tell them, talk about sex outside of the bedroom, anywhere but the bedroom. And talk about what you want to do and how you want to be touched, and make it fun. You know, don't make a judgment if somebody has a fantasy or whatever. Just go with it. And then that's what we call actually macro sex. And then there's micro sex talk. Micro sex talk is doing the process of having sex. So doing sex as you are going through the journey. Oh, this touch feels good. Not so much this one. And the first time, make it as an experiment and have fun with it. There's no one to judge you. This is the partner that you say, I do, so let's do us part. Like, it should come easily to you. And breathe. And as you breathe in, when you're having sex, as she said, don't just take your breath for granted. Feel your breath going, starting from your pelvic floor to your abdominal, to your chest, as he's entering, as you're entering, whatever. Enjoy it. Take it slow. Who doesn't love him? I mean, come on. Sexual meditation. I'm really bad. Again, this is my first speaking ever, and I'm really, really bad at it, so I'm just going to act it. So, I'm going to show you how to be fully present. I'm going to use Amy as my person. So, you know, this was actually the next slide. No, being fully present. Focus on your sensation. Close your eyes. Focus on your sensation. Tell me how you feel. Yeah. Awkward. Perfect. But that's literally what I'm talking about. And why do you think it's awkward? Because we're starved of touch. I'm a female touching another female. It should be nurturing. It should be loving. Because touch is the first thing we experience when we're born. Daily hugs and kisses are so important. I tell every single client of mine, you go home, you do a 5-second kiss and a 15-second hug. And they look at me like I'm crazy. And I'm like, wait, you don't hug? And they're like, well, kids, prioritize yourself. Your kids, you're big kids, that's it. That's all it is, with responsibilities and, a little bit of work, and life happens. And you don't. You need to experience intimacy, which is intellectual, spiritual, emotional. It's the gateway to sex. So if you're not intimate outside of the bedroom, you're not having sex. When you tell me you're not communicating outside of the bedroom, then I find out it's been 5, 10, or 15 years of sexless marriage. That's a problem. That is not okay, So we start with 5-second kiss, 15-second hugs, because you know what? If you do that for 30 to 40 days, your brain will follow and create a new neural pathways. So to create a new habits, you have to start with the new habits. Consistency is everything about sex. So don't expect after this talk you're gonna go home and have a hot sex. It's not gonna happen. But what you need to do is be mindful the way you eat. So again, back to meditation. If you're to do meditation, and I'm sure you all know what meditation is, again, awareness, no judgment. If you start meditating as you're cutting a tomato or an onion or eating a chocolate, that's your practice. That's your muscle. So practice that in other areas if you don't feel comfortable with sex, and then carry that to the bedroom. And you will see the difference. And you will come and thank me. So again, it's easy to talk about meditation, but it's really hard to be focused. Like when you meditate, I'm sorry, but women are really bad at meditation. So men are good at compartmentalizing, and since men and women think about sex, but men more often, they also think about food, they don't only think about sex. And once in their sexual experience, they have an end goal, holding like a train ride. Am I there yet? No. Am I there yet? No. You're gonna get off really soon, but let me come with this experience. So they could do that. With us, unfortunately, because we've been cultured to please everybody else but ourselves, doing sex, guess what we're doing? We're trying to please our partner. The last thing we think about is ourselves. We might have an orgasm. I'm not saying we don't. But that sometimes is not our priority. Priority is to please others. Please our children, please our boss, please our friends, society. I'm asking you to please yourself. The most important relationship is a relationship with yourself. The most important intimate relationship is the relationship with yourself. Slow down, take a deep breath, and be intimate with yourself for once in your life.